Hi, could you confirm your name and your date of birth, please?
Devin Kitch, March 3rd, 1983.
Okay, great. Thank you. My name is Timothy Martinez. I'm a student physical therapist here at UTMB. I'm going to be working with you today. How's everything going?
It's going all right. It's been better, but I'm all right.
I totally get that. Well, my job here and the reason I'm here is to get you better and take those steps into getting you back to where you were functioning before, okay? All right, so I'll kind of just give you a breakdown of some things we're going to do today to help you get there. The first thing you're going to be doing is working on your bed mobility, more specifically getting from laying on your back to laying on your side. And we're going to do that both directions, okay? Don't worry, I know I saw that you need some help doing that. I'm going to be here to help you, but at the same time, I want you to do as much as you can, okay? After that, I'm going to stretch out your legs a little bit. I'm going to stretch your hamstrings specifically and your calves, okay? The reason I'm going to do that is just because I want to prevent contractures at those joints. So what a contracture is those muscles getting too tight to where they pull your joint in a specific position and it's not able to get out of it, okay? So I want to keep those muscles nice and loose to prevent that. Okay. After, we're going to work on getting you sitting on the edge of the bed, and then we're going to work on some balance techniques to further improve your balance and your postural stability, okay? I have a tool that's going to help us with that to make it a little bit easier for you. But do you have any questions for me?
No, sir.
All right. Have you had physical therapy before?
I had therapy over at the other place before I came here, but I wasn't able to do much because of my condition, so I'm really looking forward to trying to get back to where I was, so I'm excited for therapy.
Okay, I'm glad to hear that you're excited. I'm excited, too, to be working with you. So one of those things where you said you weren't able to do much. Well, today, while we're doing these treatment interventions, I want you to do as much as you can to help me, okay? Because at the end of the day, I am going to be helping you a little bit, but I want you to do as much as you can because that'll help progress you towards your prior level of function, okay? All right, so another thing that I want to mention is we don't want to overwork you. So we want you to be aware of how you're feeling throughout these interventions and to let us know how you feel. We don't want you to get too fatigued and we don't want to overwork you because at the end of the day, we need to continue to work with you to progress you. And if we can't, then you're going to basically stay at the level you are, okay? And so we need to continue that. So this is called a Borg RPE scale. So it's numbered 6 through 20, and it just it's more of a subjective way for you to tell us how you're feeling while we're doing these exercises, okay? So your goal is we want you to stay between 10 and 13, so fairly light and somewhat hard, okay? So throughout these exercises, these interventions, I'm going to be asking you what number are you feeling right now, and you're going to kind of give me a range so that can give me an idea if we need to take a break or we can keep going, okay? All right, any questions about that specifically?
No, sir.
All right. So, like I said, first thing we're going to work on is your bed mobility. So, lying from on your back to your side, okay? So, we'll start off on the right. We're going to try a few times, see how much you can do before you feel too tired. And then we're going to try rolling to your right, okay? So, to roll to your left, I want you to try to reach towards this bar as much as you can with your right arm, and then use your legs to kind of roll over onto your left side, okay? I'm going to help you by grabbing your shoulder and your hips, but I want you to do as much work as possible, okay? So go ahead and try to reach over towards this arm railing. Good. And I'm going to grab onto your hip, okay? Just going to roll over. Way to use your legs. Good job. There you go. Good. How does that feel?
Yeah, it feels nice to get off my back.
Good. All right. Well, fortunately, I'm going to put you right back on your back, but then we'll roll back over, okay? Good job. Go ahead and roll back down. Good. All right. We're going to try it a couple more times, okay?
Okay.
So I want you to reach over to this handrail just like you did as much as you can. Reach, reach, reach. Keep reaching. And roll. Keep reaching. Good job with the legs over there. Good. All right. I'm going to roll you back down. What number are you feeling right now?
About like a 9 or 10.
Okay, great. So we're going to do one more on this side, and then we'll do the 3 on that side, okay?
Okay.
All right. Last time. keep reaching. Reach, reach, reach. Good. Keep reaching those legs. Push, push, push. Good. All right. We're going to go back down. Great job. So you're doing a lot of work right there. You're reaching a lot. You're using your legs very well. I know you have some strength in your quads, so you're definitely taking advantage of that. Good job. So now we're going to work on coming over to your right side.
Okay.
Just opposite. You're going to be reaching with that left over here, using that left leg, pushing yourself. Okay?
Okay.
All right. Go ahead. You're going to try to reach as much as you can. Okay? Good. Good. Use that left leg if you can. Good. Good. Roll. Roll. All right. We're going to roll you back down. Good job. So these are definitely good techniques that we're teaching you. These are just the foundation of all bed mobility that you're going to be doing in the future. So you're doing really well. I'm going to try to do 2 more, okay?
Okay.
All right. Keep reaching. Reach, reach, reach. Use that left leg as much as you can. There you go. Good. Good job. All right, I'm going to roll you back down. What number are you at right now on that scale?
Probably about the same, like 10.
Good, so you're not getting overworked. So you're saying we could work you harder.
Not too much harder.
Okay, I got you. All right, we're going to try that one more time, okay?
Okay.
Go ahead, start reaching. Reach toward that arm rail. Good. Use that left leg push, push, push. Good. All right, we're going to roll you back down. You can move your head a little closer onto that pillow. Good. All right, you did great right there. Like I said, that's just the foundation of all bed mobility and getting towards your independence. That's going to be good later on for you to start moving around by yourself, okay? All right, like I said, second, I'm going to stretch out your hamstrings, okay? And stretch out your calves. So I'm going to do one leg at a time. I'll start off with your right leg. I'm going to do 4 sets of 30 seconds each. So I'm just going to bring you up, hold you there. But while I'm doing that, one thing we can kind of add to knock out 2 birds with 1 stone is we can do some pursed-lip breathing. Basically what that is you're breathing through your nose for 2 seconds, blowing out your mouth for 4 seconds, like you're trying to blow out candles. So I like to say smell the roses, blow out the candles, okay? That's just going to help with your breathing pattern. I know that's something that's really affected by Guillain-Barré, and so that's something we can kind of work on to improve while we're doing these exercises, okay? So while you're doing that, place your hand on your stomach, and you should feel your stomach rise while you're doing that. That's the pattern we want, okay? So go ahead and try 1, 2 seconds, and 4 seconds out. Good. 1 more. Good. All right, I'm going to start stretching your hamstring now, okay? You just go ahead and keep breathing and relaxing up there. Good.
Yeah, I feel like I was running a little bit out of breath when I was rolling, so this is good.
Yeah, it's definitely a good technique to just kind of do whenever. It'll help relax you. If you're in pain, sometimes it can help decrease the pain because just overall it relaxes your body.
Yeah, I think my breathing's definitely been affected by this disease. So.
Okay. And then later on, we're definitely going to work on some techniques that'll help you improve your breathing overall. That's just something we can use throughout right now.
Okay.
All right. Good. Any pain in the back of your leg? Do you feel a stretch back there?
I feel a slight stretch, yeah.
Okay, good. That's what we should be feeling. All right, so now I'm just going to stretch your calves, okay? Do you feel that in the back of your lower leg?
Yeah.
Good. All right, we do that. 30 seconds. So how's your family been during this time?
They were worried about me, you know.
Yeah.
They didn't know what was going on. I didn't either. Then I came in and they told me I had this Guillain-Barré.
Yeah.
And, everything started getting even worse, and I think it's starting to get a little better though. I think I'm getting some strength back and some pain.
Good. I think you are too. All right. Let me stretch out this one. Definitely some tightness in the back of your leg, but that's why we're working on it. So on your exam, you weren't able to get up that much. You're definitely getting up a little higher today. That's great.
I think my strength and my flexibility is slowly coming back.
And that's what it's going to do. You're slowly going to start getting better and better. It just takes time. So the biggest thing is trying to stay positive because it's just steps. Yeah, there's steps to get to your the final result. And being positive just helps that even more.
I just want to get back to doing landscaping and working.
I saw that you work. Do you work a lot?
Yeah, I do housework and landscaping, and I just miss hanging out with my kids, going out to dinner with them. So I just want to get back to it.
I can definitely understand that you'd miss that. That sounds like it's a big part of your life. All right, we're gonna do one more, okay? How are you feeling right now?
I'm feeling good. I feel like I'm a little. Yeah, you're stretching me.
Should feel nice and relaxed a little bit too with that breathing.
Yeah.
Okay. So the last thing we're gonna do is work on that. You're gonna work on that sitting balance. Okay. So I have something to kind of help us with it. I have this little pole. So when I get you sitting on the edge of the bed, or when you help me get you sitting on the edge of the bed, we're gonna use this pole. You're gonna grab onto it, and it's just gonna use your arms to help with that balance. Okay.
Okay.
I'll be helping behind and in front though. And one thing I kind of want to do with you, you just said you want to get back. You missed getting back into your landscaping business. We're going to pretend this is a ride or a push mower, okay? And so I know it kind of seems very minimal, but keeping things in perspective and having goals to get towards is definitely going to help your recovery. So I want to implement as much of your life into your rehab process, okay?
Oh, I like that. Hey, good old push mower, man. I remember those.
You probably don't use that as much, but all right. So we're gonna you're gonna roll over just like we were. So go ahead and keep reaching. Good. Good. All right. And from here, I'm gonna go under your shoulder and help swing your legs down. Okay.
Okay.
You're gonna help me as much as you can. We're gonna come to sitting on the edge of the bed. Okay.
Okay.
1, 2, 3. There you go. Good. Can you try to bring those feet underneath you? Help you out a little bit. Good. Good. Just right there. Okay. So I'm going to put this in your lap. I want you to try to grab this arm rail. There you go. Good. And so I'm going to raise it up. And I'll have you. And we're just going to try to balance here, okay?
Okay.
Good. There you go. Deep breaths, just like we practiced earlier. Good. See, I'm not even holding on to you as much. About 10 more seconds. Okay, we're in. What number are you at right now?
I think I'm like a 14, over a 13, I think.
Okay, so you're up there. Let me catch this from you. I'm gonna put that over there. All right, so I'm gonna lay you back in bed and we're gonna relax and we're gonna be done for the day. Okay?
Okay.
All right, you did really well. Your balance was really well. Good job.
Yeah.
All right, so I want you to fall onto this arm, and I'm gonna help bring your legs up onto the bed. Okay?
Okay.
Ready?
Yep.
1, 2, 3. There you go. Good. All right. So while you're in bed, I want you to move around as much as possible, like we were just practicing. Okay. You can kind of reach over to here, reach over to here. Do that every hour. That will just help from preventing any skin breakdown or injuries to your skin.
Oh, okay.
While you're laying in bed. Okay. Do you have any questions for me?
No, sir. I think that helped. I can't wait for our next session.
You did really well. Definitely excited to get you back to where you are, okay? Thank you, Mr. Kitch. Thanks for letting me work with you today.
Thank you.